Are you on any blood pressure medication? Gee, in the last couple of months, I've been hearing stories of Health Canada recalling different medications because of cancer risks. I want to talk with Dr. Fernandes out of the Heart Fit Clinic. Coming up next, what are you supposed to do in this case? We're back after this. Well, if you take blood pressure medication, you'll want to be aware of this. Health Canada expanding the recall of drugs to include more Valsartan medications. I know Dr. Fernandes will be able to say it correctly. Dr. Diamond Fernandes is with the Heart Fit Clinic. Dr. Fernandes, thanks for your time today.
Thank you very much, Doctor. I'm the director of the Heart Fit Clinic here in Calgary. So,
well, let's make sure we're clear about that then. Yes, the director of the Heart Fit Clinic. But can you give me an idea, Diamond, when it comes to high blood pressure? A lot of people do have to turn to medication to control it, don't they?
Absolutely. I mean, blood pressure is a very important thing to control. It's one of the most important things as a risk factor to control, especially when we're trying to prevent and control heart attacks and strokes. So absolutely one of the most important medications out there. Unfortunately, yes, it's been in the news a little bit with the controversy, but it's not the first time, though, either. So, angiotensin receptor blockers have been in the news in 2010 as having carcinogenic effects and potential risk of cancer as well. So now it's coming out with some more common and very, very common prescribed medications. I mean, a lot of our patients in our clinic are taking the Valsartan, especially in combination with hydrochlorothiazide, which is a water pill for controlling blood pressure.
So tell me about Valsartan then, because is that the concern, that it's the Valsartan that is the cancer risk? But yet I'm looking at a huge list of drugs that have it in there. So why is it even in there?
Well, I think it's anything that has any effects with Valsartan as well. So Valsartan can be combined with another type of drug, which is a water pill. And so those are some of the things. So they just expanded the list to all the different dosages of that as well. So angiotensin receptor blockers are usually, sometimes a first line or even a second line treatment for treating high blood pressure, right? And it's important to keep blood pressure low. It's important to prevent heart attacks. It's important to prevent strokes. It's important to also prevent kidney problems as well. So keeping blood pressure low is very important, and we know that. And there are other classes of medications, and I think it's important for the listeners out there is that to just not stop your medications, is to talk to your healthcare provider as to other options to controlling blood pressure. And one of the things that we focus on the Heart Fit Clinic here is really finding out, well, why do you have high blood pressure? Because that's an important thing to look at as well. And so if you're going to your family doctor and they're writing the prescription pad, it's absolutely important to control high blood pressure, especially if it's really high. But the next thing is to find out, well, why is it high? Do you have some deficiencies? Do you have some micronutrient deficiencies, hormone abnormalities? There's all these other things that we can kind of look at. And our focus is to basically prevent and reverse heart disease at the Heart Fit Clinic to make sure that we can see, well, why do you have that problem and get to the root of the problem? So it might be a good opportunity for the listeners out there to find out, okay, what more can I do to see why I have the high blood pressure? And more importantly, what can I do to reverse it? Is there some other things that I can do to treat it naturally? But once again, it's not a medication that you just want to stop and discontinue. It's definitely something that needs to be discussed with your healthcare provider in more detail and individualize that problem or that situation.
Diamond, are you understanding it? And I'm looking at the Valsartan, but it's more because there's impurities within that Valsartan, or what have you heard?
Yeah, there's the carcinogenic effects in the Valsartan itself. And so there's a molecule in there. I can't remember offhand. I remember, of course, reading it in the trial that was done. It was NDMA. But the point is that specific component, it has a carcinogenic effect. And, that's the
So within
that's
the Valsartan, okay.
About.
Yeah, I'm just trying to understand, is it the Valsartan, or was there something within that Valsartan that was the concern? But regardless, it's that risk of cancer.
Yeah, and that's the risk of cancer. And, of course, no one ever wants to be having that part of it. And so it's once again, it's important to understand, well, why do you have the high blood pressure? What are some things that you can do to control it naturally? And our body is designed to heal itself, right? And so it's important to say, okay, well, what is it that I can do to help heal it? And that's what we kind of focus on that. So it's basically a trace of inside the Valsartan, and I think I said NDMA, I was correct in saying it basically means it's a big, long chemical profound. But
Yeah.
that's the concern that we have with Valsartan, and so
is that trace of that NDMA. All right, so go back to the whole idea of are we sometimes too quick to turn to a medication as opposed to, looking at your lifestyle? You often hear about making sure you're not smoking, you've got to watch your weight, are you exercising enough? Are those some of those natural ways that people maybe have to look at before they are looking for a medication?
Yeah, and once again, I think medications are very important early on in the disease process, and hypertension, unfortunately, is a silent process, right? And so, of course, it's important to get that checked and regularly maintain that way. But I think the more important thing is to say, okay, well, what can I do to control this naturally? I think pills are important early on in a process. I think it goes beyond that and allow the body to heal itself and give it the right environment to do that. And yes, it does come down to making sure that you understand exercise is very important. We all know that. But understand nutrients and micronutrient deficiencies. I think those are important things to look at, is to say, well, why do I have that? And then even looking at even further that, because why someone has high blood pressure is different from the other person that has high blood pressure. And we want to get to the bottom of that. And that's why it's important to talk to your healthcare provider or, the Hartford Clinic, like what we do, is to kind of see, well, why do you have that problem, and get to the root of it rather than just trying to mask everything with a pill.
Are there cases where people can eventually go off medication?
Absolutely. And that's something that we do in the clinic all the time. And there's some patients that we're not able to do that with, and it's because it's just too far out there. And if patients have too high of a high blood pressure, yes, medications are going to be an important thing. But I think this gives people an opportunity to maybe say, okay, well, we know medications are of benefit to me, but there are risks with any medication, right? And so there's always a risk when you do put something in your body that is of a chemical compound that your body's not used to having. And so, like I said, it's important to then look at some natural options to be able to do that. And so many ways, but it's important to get to the root of why, right?
And so, Diamond, you said definitely talk to your healthcare provider. I appreciate your input on this one.
My pleasure.
Diamond Fernandes, a director of HeartFit Clinic. The recall involves any of the drugs that are Valsartan. So they come from Teva Canada, and just want to be aware of that and talk to your healthcare provider whether or not there's something else you can be on, because as Diamond mentioned, it is the trace amount of this NDMA.